Hello Hyderabad, this is Juve Talks. I'm Satesh Ragoo. I think it's been quite a while since we last saw each other. There was a season change, so now we're just about the cusp of winter. We wish you a very warm welcome. This is episode 5. We had done previously some great work, and more than that, you guys have been along with us hand and foot on every step of the journey, and we want to say a very special thank you for that. All right, so in this particular episode, we're going to focus a little bit on healthcare. Why healthcare? Because the market in the state of Telangana currently stands valued at around 1.42 billion US dollars. That's a lot of money. And Hyderabad is also known across the world as a destination for medical tourism. So why not focus on that a little bit today? In addition to that, what seems even more promising is the fact that probably by 2030, there is a forecasted growth in that revenue so that the market size might actually be in excess of $100 billion. And this is not within the country, we're talking about in the state of Telangana. So that's quite promising news. I have with me a dynamic medical duo featuring two very accomplished doctors, young accomplished doctors, mind you. All right, let me introduce to you our guest for today. We have Dr. Manikanth Karumuri. He's a consultant plastic and reconstructive surgeon. And I have also with me Dr. Viswanath Atreya, who is a consultant endovascular and vascular surgeon. Both are co-founders of Ikigai Hospitals in Kondapur. Welcome to the show, guys.
Thank you so much. Thank you so much.
Thank you. So, with one particular medical professional being in the line of vascular surgery and one other professional being in the line of plastic and reconstructive surgery, it's quite a blend of specialities. And I would just like to understand how both specialities technically overlap and interact with each other, especially in the treatment of diabetic foot disease and chronic wound treatments.
So, for any tissue to be viable, for any tissue to survive, it needs good amount of blood supply, oxygen, nutrition. Along with that, it needs a treatment of its infection and a proper wound cover. This is what a journey of a typical wound towards its healing is. So, for any kind of disease like a diabetic foot, if you look at the care cycle, so it's dependent on its blood supply, its biomechanics, its sensation, its infection cure, and the wound cover. So when we as two different specialties come together, so we provide both the requirements in a single shot. So I as a vascular surgeon take care of the blood supply and make sure that there is enough blood to carry their nutrients, drugs or whatever to the wound surface. And Manikanth as a reconstructive surgeon, he makes sure that the wound is properly offloaded, the infection is being treated, and it's properly covered so that a functional walkable foot is formed. So that's how we both come together as a specialties to heal a chronic wound or a diabetic foot. Your take on that, Manikanth?
Yeah. So coming to the common public perception, patients doesn't know which particular specialty they need to consult whenever they are having a wound in their foot. So that is the main reason why we came together, because a patient walks into a wound care clinic with one particular impression in his mind. They might meet a plastic surgeon or a vascular surgeon out of the awareness they have. So it is our job to figure out in this particular individual we need the care of plastic surgeon or vascular surgeon or both. So that is the reason a close dialogue and discussion regarding the wound and a collective assessment is very, very important coming to the treatment of complicated non-healing diabetic foot ulcers.
Now, Dr. Karumuri, when we think about again that blend of specialities, I would just like to understand for Dr. Viswanath's vascular expertise, how does that exactly impact on the success rate of your reconstructive cases?
Yes. So as I previously said, once there is a wound, it is our job to work it up and know the reasons behind this particular patient's wound. It might be purely uncontrolled diabetes, it might be compromised blood supply, it might be a combination of both. So when we are looking at it as a whole and to find what are the causes and find each and every root cause behind the ulcer, then only we can give a sustained and a quick result. If I am focusing only on my specialty of expertise and if I am giving patient treatment and doing my workup only, many of the times we might be losing that valuable window of establishing the vasculature in case if I am missing that. So that is a place where vascular surgery, especially involving the vascular team timely and quickly, is very very important in attaining the end result.
It's quite an interesting concept actually. I find the name itself Ikigai, it's such a powerful thing. And many people in Hyderabad, I think some people who are avid readers would be quite fascinated by that term because it's a Japanese term which means reason for beings. That's how one interpretation would be. So I would like to know from you guys, how does that exactly translate into your overall operations and your mission for patient care?
So let's start with briefly on what Ikigai actually means. So whatever work you do, it should be something which you're good at, something which is your area of expertise, and then it should earn you something, and it should also serve the society as a whole. Okay. So when we both were working in private health sector in corporate hospitals, we came across patients who used to, suffer when they have a leg wound because of several reasons. Though we individually are good at what we are doing, though we tried our best to give a comprehensive care to the patient, there were certain limitations which we as doctors could not do, which we could solve as entrepreneurs or healthcare providers when we had our own center. So they being, when you look at a cycle of care for a patient with diabetic foot or a long ulcer, or a chronic ulcer, he needs a consultation and a proper consultation. They need to know where to go or whom to meet. And then after that, they need a proper assessment. So any diabetic foot will have at least 3 issues. One is infection, second one is blood supply, third one is what we call as neuropathy. It's changes in the form of sensation and the shape of the foot. Okay. And then after the assessment, they may need some kind of intervention, probably a surgery to improve the blood supply, correct the shape of the foot, or cover the wound. And after this is established, then there is a cycle of what is called rehabilitation and recovery. And after that, there is secondary prevention, where you don't want that ulcer to come back again. So this entire cycle, if a patient has to undergo, he has to move or she has to move between several places in the city, sometimes which are like 10 to 20 kilometers apart because they don't have services under one roof. Also, if they do come across a big hospital where most of the services at least are available, even they have to move between floors and they spend entire day just juggling between the floors. Okay, so this is one problem, one challenge which we thought we wanted to solve, and that's very close to our heart. So then we came across a Harvard Business Review article by Michael Porter, which says the need for the cure for the current healthcare system is what is called as an integrated practice unit. So Ikigai Hospitals is an example of integrated practice unit. So these are not hospital or specialty centered. These are a value-based medical systems where the healthcare is designed around a patient's particular health condition, so that entire care cycle takes place under one roof without moving the patient much. So this is the core concept. So this is what we want, the challenge that we wanted to solve, and this became our Ikigai.
Quite a beautiful story. And actually, I think in India particularly, there's that plague of diabetes that's affecting a lot of people. So the need for things like limb salvage and saving of limbs, it's a very pressing issue. I can even tell from my personal experience that in my family, my own grandfather, he had actually lost a limb because of the need for this kind of treatment. So Ikigai Hospitals is known as that specialty center in the state of Telangana, in the city of Hyderabad, that does this very specialized kind of treatment. Now, moving a little bit further, I wanted to understand, because we've established your surgical expertise, but I actually wanted to understand, besides the surgical expertise, what else really sets your hospital apart?
So there are a couple of things. So one thing we wanted to know is, whenever you go to a hospital, no one wants to go to a hospital just because of the feel. But everyone wants to go to a place like Starbucks. Even though they don't serve the best of the coffee, it feels good to be in Starbucks and chat with your friends. So we wanted a hospital that feels equally good. Patients or there are bystanders who wait for the patient while the patients get treated. We don't want them to feel awkward or bad, or we don't want the particular hospital feeling where it smells certain kind, it looks certain kind. That's what we are used to. So we designed our hospital in such a way that it's pleasing to be at or wait for some time. So many of our the bystanders and patients, when they say and when they look at the hospital, they're okay to be there. Okay, that's one part we really wanted to take care. And second thing, as I mentioned earlier, is the integration of services. Okay, so in any hospital, you say they're not designed around a patient's condition. They are designed as per the hospital's specialty needs. Okay, so one uniqueness about Ikigai Hospitals is anything that is required for wound care, anything is available under the roof. You don't have to go anywhere to get yourself investigated or treated. Whether you require a highest form of technology like a hyperbaric oxygen therapy or the footwear, or we even have a hybrid cath lab where we can do an open part and an endovascular part together along with wound reconstruction on the same table without moving the patient anywhere. The patient needs a very complex surgery in the form of, say, a bypass surgery, stenting, and then wound care. All of them then can be done in single setting because both of us are there available immediately. So one more uniqueness is, so whenever most patients with diabetic issues, they require cross consultations. Cross consultations as in they need to be looked at by a vascular surgeon to establish the blood supply. They also need the most crucial part probably is the reconstructive surgeon, who make sure that once the blood supply is adequate, patient can walk on his foot and design his reconstruction in such a way. So whenever a patient with these kind of problems come to Ikigai Hospitals, both of us are available, and if at all a patient pays a consultation fee for one, we ensure that both of us see under the same consultation fee. We don't charge again. Okay, so we don't charge again. So it's that's the kind of feel that we want to give to the patient, that you are in safe, ethical hands, and we are not after fleecing you out of money, because we have seen several incidents where it really pinches a patient's pocket to keep spending because it's not easy. An analysis shows that patients with diabetic foot ulcers, particularly from rural communities, they spend close to 30% of their family income on treatments.
Absolutely. I think it's very important for us to establish the fact that in today's medical reality, ethics plays a big part of it, and I think it's refreshing that we hear when hospital administrators, because apart from practicing yourselves, you are running this entire establishment. So the idea is that when you put ethics into the work that you're doing, it's something that really sets you apart. But I think that more than that, patients would be wanting to understand how I can actually save money in the long run. How do I save my loved ones from getting sick? So that brings me to the next question, which is, in this reality where people are suffering from vascular issues, what kind of advice would you be giving for someone who may be experiencing early stages of vascular problems? And also for you, Dr. Manikanth, for this proliferation of plastic surgery, reconstructive surgery, and the need for it, what kind of advice would you be giving as well to persons who are exploring options to go on through that path? So I'll start with Dr. Viswanath and then we'll go with Dr. Manikanth.
If there is one word that can, cinch upon what to do to prevent vascular issues, that's lifestyle. Okay, lifestyle is the biggest issue today, and we keep talking a lot about that, but implementation is next to zero. Okay, so one single risk factor for any kind of vascular disease, most of the vascular diseases per se, is what is called as atherosclerosis, which essentially means that there is accumulation of unhealthy fat inside the blood vessels or arteries. Okay, so that leads to blocked arteries, and these arteries can block anywhere in the body. If they happen in the brain, they lead to something called a stroke or cerebrovascular accident leading to paralysis. If the same thing happens in the heart, it's a heart attack. If the same thing happens in the legs or hands, it's peripheral vascular disease leading to gangrenes, ulcers, and sometimes limb loss. Okay, so if you can prevent or take care of your aging arteries or atherosclerosis, you will not suffer from any kind of these diseases, lifestyle diseases. So idea is, there's one risk factor which we cannot modify, that's our age. That's something you cannot modify. But things that can be modified are, if you're a diabetic or a hypertensive, keep them under control, use your medications regularly, keep them under check, meet your physician regularly on a daily basis, get your doses adjusted. That's plays a very crucial role. Take care of your diet, eat healthy, maintain healthy habits, exercise daily. So every day, 40 minutes of walking on at least 5 days of the week can help you do wonders. Okay. And if you are diabetic, make sure you check your feet daily for ulcers, cuts, corns, callosities. If you find something which is abnormal, do meet a nearby physician or a surgeon to make sure that it's not getting dangerous or out of hands. And smoking. Tobacco is probably the number one abusive item that can lead to these kind of issues. So say no to tobacco in all its forms, in all its quantities. Sometimes people say it's just a cigarette, just one cigarette a day or one BD a day. No, any kind of tobacco in any dose can cause irreversible damage to your blood vessels. And if you can quit smoking today, within 2 weeks you'll start aging in reverse. So I think if you can take care of these issues, maintain a healthy diet and healthy weight, I think more or less you're good.
Yeah. Coming to the plastic surgery point of view, and especially in diabetic foot, as just Dr. Viswanath mentioned, if you are diabetic, even without a qualified doctor saying that, you have as a society, we have this tendency to go and meet our primary care physician who is treating diabetes in frequent intervals. It may be 3 months, 6 months, 9 months. In the same way, if at all you are having long-standing diabetes and you already started having tingling, burning or numbness in your feet, so we should make it a norm and make it a regular process, that it's not you're just meeting your diabetic foot surgeon or your foot care doctor once in a blue moon when it is really bothering you. Just like the way you frequently monitor your sugars and get them corrected and your treatment titrated, in the same way you need to meet your diabetic foot surgeon to see from the last consultation till now how it has been. Did it progress, did it improve, or did it worsen, or something new developed? So this is a constant ongoing process we need to do. Check at home, at the same time meet your doctor in frequent intervals. If needed, get relevant investigations done, and also a frequent footwear change depending on the needs of your foot. So this is a trend we need to set. It's just not like you're having diabetes, you're just meeting your doctor and getting it treated. In the same way, we need to make sure our feet are also taken care of accordingly. And one more thing, we strongly believe in the concept that if someone is losing a foot or a leg, it's not the patient who is suffering, the entire family is going to suffer. If that one individual is the sole bread earner for your family, the entire family equation gets upside down. In the same way, if that particular individual needs to go to a hospital even for basic medication or consultation, there are very, very high chances he might not be able to go on his own. Again, the family member or all the family members take out their time, take off from their workplace, and then they make it happen. So it's not just one foot we are treating a family. We are making sure a family's quality of life and their finances are taken care in a right way. Whatever time you are spending on your treatment or the money you are spending on treatment, we suggest that it should be focused on saving a limb and having a better quality of life than losing a limb and facing the consequences.
In continuum, the one strong philosophy that we believe in is that your feet should take you towards your dreams and destination, but not towards visibility. Okay, so and these dreams and destinations, they vary with age. Particularly in elderly age, all they want to do is probably walk around with their grandchildren and be able to go to washroom on their own. That's what probably they dream of. Okay, but most cases, in most patients, particularly in rural areas and where the awareness is not less, they suggest the patients undergo primary amputations. But then, who wants to limp? Who wants to go to the washroom, even for a small thing like going to a washroom, be dependent on their family or caregivers? No one wants to. So if at all someone can get help and get treated at the right time, you can save a limb and you can save a life and you can make a family very, very peaceful and comfortable. In the last 1 month, We have operated 5 patients who are 85 plus. 85 plus, all of their limbs salvaged. All of them now they're going to walk, stand on their feet and carry out their daily activities. But that's all they wanted. They were not thinking of going on a trek or going on a hike. Okay, so if you can make sure that these things happen, I think we have achieved a lot.
Now, as two very young entrepreneurs who've accomplished a lot for yourselves because you're both doctors, you're both specialized in very key areas, I just wanted to understand what kind of vision you have for your hospital over the next maybe 12 to 18 months. Where do you see Ikigai Hospitals going to be?
So I think the focus of our hospital is still on patient and community awareness and education. So we want everyone to know that amputations are preventable. No one needs to go on under unnecessary amputation provided they get their feet or ulcers checked in right time, and if they know how to prevent or take care of the feet, we probably should not have any diabetic or any person, elderly person undergoing an amputation. Okay, so our goal ultimately is to look towards an amputation-free Hyderabad, amputation-free Telangana, and probably one day amputation-free India. So that's what
I would like to add to this. So currently our majority of the patient pool is someone who is already having an ulcer, someone who already underwent some surgery, someone who already lost one limb and now they are trying to save the other limb. But what our vision at a longer run is, we want to see patients who are coming in with the concept, sir, I am having diabetes since 5 years, I am having diabetes since 10 years, or I am smoking since last 10-15 years. What I can do now to prevent me from getting ulcers in future or preventing my limb from getting amputated? So it's more about prevention than cure. So that is our major motto in long run.
Absolutely. So there you have it. We've heard from both doctors. We've covered quite extensively on the areas of speciality. And I think we can all agree that Ikigai Hospitals have quite a bright future ahead of them. And if you're ever in Kondapur, please don't feel a stranger. You make sure you go, you check them out. It's quite a beautiful place to be, and I actually had the pleasure of being there myself. It's a wonderful clinic. It's quite an experiential, I think, visit. So what I feel is, moving forward, ladies and gentlemen, this podcast is one that always talks about turning a vested passion into an active business. So if it is you're able to bring these things forward and turn it into a business and make money out of it, earn a lifestyle, a livelihood out of it, then that's a wonderful thing to do. This has been Juve Talks episode 5. Before you go, please don't forget to like us. Please don't forget to subscribe. The details of Ikigai Hospitals will be shared in the description below. So don't forget, look out for us in the next episode. Thank you so much, everyone. Have a wonderful day.